disordered individuals in mediation. I mostly will be talking from the point of view of somebody who has done and participated in family law and child protection law mediations. But I know a lot of you do other kinds of mediations, so if you want to interrupt with questions about how this would apply to them, do so. I think that there are personality disordered and other disturbed individuals in all kinds of places in life and all kinds of mediations, so I'm sure that some of it will apply. I've given this talk a lot of times in different places. I'm going to presume you're looking at it, so if I lose track, if you lose track of something and I say something that doesn't make a lot of sense, let me know.
We also have a copy of the slides that we can give you a paper copy. We can email you a copy afterwards if you would like one. So I'll have a sign-up sheet back there for if you would like a paper copy.
You don't have to try to read what's on the screen now.
I'm not going to read this computer. There's nothing that's going to be on the screen because we weren't able to figure out a way to project the slides. So the first thing that I want people to do when they're starting into mediating and somebody has sort of a rep as being a little odd is make sure that they are not seriously mentally ill or legally incompetent. The two major kinds of folks you're going to run into in family law mediation anyway are people who are psychotic or people who are suffering from post-traumatic stress disorder. Those are the two most usual kinds of people where you have to worry about mental illness. So the questions you want to ask yourself are, can this client speak for himself? Is his mental illness interfering so much that he's not going to be able to talk for himself, even with the help of an attorney? Sometimes it can be useful to bring the person's attorney into the mediation to help with that. Can the person reach an uncoerced agreement? Now, those of us who have worked with domestic violence know very well that there's a huge issue in domestic violence about whether the person can reach an uncoerced agreement or whether they're going to be too influenced one way or another by having their domestic partner or ex-domestic partner there or nearby. Can the client be safe between mediation sessions and after the mediation? This is very important because there are domestic violence situations where the perpetrator can act quite friendly and reasonable during the course of the mediation. And one can naively presume that the person, the victim of the domestic violence is able to, is safe. And that may not be true. And this one comes from Zina Zumeta. I have to say that when I first gave this presentation at the Institute for Continuing Legal Education at ICL many years ago, Zina, I took Zina to lunch and she provided a lot of the helpful ideas that I'm going to be talking about. I won't credit her every time, but this is the first one. So Zina wanted to say, this is really specialized mediation if somebody is psychotic. Are you able to do it? And it may be that that mental health professionals with the right kinds of training are able to do it. And following on that, do I need a co-mediator? Maybe you are the best mediator for that group, but you need somebody else there. So what about mediating with somebody who is psychotic? They're of greatest concerns in terms of competency. These include people with schizophrenia, bipolar disorder, with psychotic features, depressive disorder with psychotic features. Sometimes people don't think of depressives as sometimes getting psychotic, but depressives can have specific delusions for instance, that they're turning into a skeleton and dying when they're clearly not. Substance abuse psychosis, enough substance abuse can make anybody psychotic, and postpartum psychosis, which is very important to remember. Always consult, if you're a lawyer, always consult with a mental health professional at the very least with these cases. And again, keep thinking, am I equipped to do this mediation? What can the mediator do with these cases? Watch for very disorganized thinking and unusual trains of thought or incoherence. Unusual thinking is attending to internal stimuli, appearing to think about things that are going on in their own head in a kind of preoccupied, quite odd way, and attending to hallucinations, hearing voices telling them what to do, various signs of incoherence. Make sure that people are taking their psychotropic medications before the mediation. Antipsychotics, which may not be your favorite in general, can really help straighten out these kinds of thinking problems. And then if it's not working, do give up, because nobody may be able to mediate with this first group. I'm going to move on to the personality disorders, where I think most people could get something done with them, but with these people, just keep an eye on it, and nobody may be able to do it. A second group is people with post-traumatic stress disorder. The post-traumatic stress disorder, which many of you may have run into, it involves flashbacks, nightmares, denying memories. So if you try to talk to them about, for instance, an episode of domestic violence, they may have no memory of it, or they may want to just not think about it. And you may think that the whole plan, for instance, for the divorce after the mediation should involve avoiding ways that this is going to happen again, and the person can't remember that it hasn't. Detachment from others and depressive symptoms are two other things to watch for. What can the mediator do in these kinds of cases? Remember that the person's memory is not going to be good. Consider having a psychotherapist, the person's psychotherapist, at the mediation. I'm going to say that more than once in the course of this presentation. If the psychotherapist is there, very often you're going to have to work in caucuses. So, because it's just not going to work to have somebody's therapist holding their hand right there while the other person doesn't have a therapist right there. Or, so in that case, and you may get more done with truly mentally ill or traumatized people if the lawyer and the therapist are with that person and helping the person feel reassured enough to communicate more rationally. And again, mediation may not work. So now let's move on to personality disorders. And as I said, I think these people are very often in mediation, and usually it's possible to do the mediation with them. I always start with the psychotic and incompetent people, because I want everyone to keep their eye out and realize that you could, especially if you're a non-lawyer, lawyers should have their antennae up for people who are too incompetent to sign agreements, but I think the rest of us might not. So borderline personality disorder, for those of you old enough to remember Fatal Attraction, I think the woman in Fatal Attraction is probably about as good an example as this occurs in about 2% of the population. 75% of borderlines are female, and we're going to go through the symptoms. The fact that they're mostly female at various points has caused there to be a real backlash in the mental health profession. I can remember times where if you really got to hate somebody, you would just say they were borderline. That would be code for saying something nasty about them. And I do think you have to watch